15 minutes. Shall we give 5 more minutes?
Yeah, just give 5
If
more
anyone
minutes.
Nilani, I think she usually joins.
Yeah.
So, Mr. Ratnam,
With me.
What about
Lawrence.
Yaso?
Yeah.
You're on YouTube as well. All of you.
Yeah, Lawrence.
Yeah.
So, what about your favorite country and a favorite president? Are you going to visit us here and say hello to him?
No chance. My wife won't even go near. Flatly refuses to go. Doesn't want anything to do with America. Never had.
So you don't even
Sorry.
want to have.
By mistake.
So no chance of visiting.
Everybody is talking. You can join whatever the time. Even after 15-20 minutes, no problem.
Yeah, having a wonderful time.
Okay.
Well, she's a lucky one.
I
She has.
thought he was going to win. I'm surprised that people are surprised. I mean, the internet was very clear that he was
Sure. No one is surprised. No one is surprised, but what is surprising is the rate at which they did it and the vindictiveness with which they are doing, and the crazy people who are brought in to run the place.
That's nothing. Wait till the show trial starts. This is only the beginning. He's only softening the judiciary and
but resistance is right. I mean, there's already substantial resistance coming around. He's backtracked. 95% of the cases he has lost.
That's going
but
to
change. Who is edging him on? There must be some force behind him.
No. He
doesn't have brains to do that.
No. There is a whole. It's oligarchy in forming, like what happened in Soviet Union. The rich fellows want more money and control and knock the federal government so that they can take control of the government and everything they do. Takes more money, and there is a force behind it, combined with some white nationalistic thing, all kinds of stuff. Anyway, we'll talk later.
There are some good studies on why he won. It's mainly, as Karunian said, on race, on white supremacy. But that's been obvious for a long time. That's why he won the popular vote.
No, also I think Biden screwed up in a major way. Padmalingam's friend, but he still should have stepped down much earlier. He should have stepped down a year earlier, had a nice primary. There were a number of nice, good candidates. Andy Besha, Gavin Newsom. The young guys. They would have definitely. Anyway.
They would have lost anyway.
So shall we start though?
Yeah.
I think we should, yeah.
I just thought we might.
I like to welcome you all.
1 minute, Sam, Edwin is coming in. Let's see. Edwin and Gloria are coming in.
Okay. No.
Shall we wait for 2 more minutes till 6:20, Sam?
Anyone heard from Srima? She joins too sometimes. No news from her people in London?
Srima is connected, but I don't know. Yeah, hi Edwin.
Hi Glory. Hi Glory. Thank you for joining. Srima is here. Sarojini.
Where? I don't see her.
She's not here, but this one of those things she says Srima she's muted. Maru, that's Srima, right?
Yeah, that's Srima, yeah.
Oh, I don't see her.
Srima, can you unmute yourself?
Sarojini, how is this, what's his name, the junior batch guy who joins us? Jayasri, yeah.
I sent him the thing and he said thank you and all of that. He's kind of in the process of moving house, and so I really don't know. I met him like 2-3 months ago even at Ashokan's. Yeah, okay. So I did Dharma also and Nisanka.
Okay.
But I don't think Dharma and Nisanka will join us. I don't know if he gets a chance, he might.
Currently, you are joined through something else as well.
No, that's my wife. Inbam is on the line. Inbam, are you there? Inbam, you can show your face. She wanted to join because I promoted this as saying words of wisdom of on remaining healthy on someone who's healthy and positive and has hair on his head. That's
Everything,
she's
all
on
the
a
hair is
different.
evaporating.
Hi, everyone. Nice to see
Hi,
you.
hi, Inba.
Hello.
This,
Hi. How are you?
Hi, Inpa.
Hi.
So I told her also to come to
Hi,
listen to
Benita.
Sam.
I
Hi,
just
How are
thought
you?
we
Nice.
could,
Taro,
could
nice to see you after ages.
I thought,
Yes, hi. Hi,
hello,
Sam.
hi there. I hope we'll see you sometime this year.
Maybe by the end of the year,
Maybe,
hopefully.
I know.
Oh, wonderful. This, I just thought we'll have a little discussion among ourselves because we are sort of in our 80s. Even Maruf is over 80 now. This,
Even
this, one of the things is one of the things I wanted to say was we lost a neighbor of ours whom I went to see on a regular basis, almost twice a day, and she had liver failure and she had ascites and all that. And whenever I went, they said, my mommy starts coughing. So I was thinking to myself, what on earth is going on? And I discussed this with Karunya to some extent. Why people aspirate, especially at old age. Now, the thing is, when you get food or fluid into your mouth, now the fluid has got to pass over your larynx. That is, larynx is generally kept open, but when you swallow, the epiglottis comes and closes your larynx so that the food can get posterior to the larynx, that is to your oropharynx and then to your esophagus. But in situations like this, the way these people were feeding, the two daughters were feeding her head was extended. It's so like that. They were feeding her like that. And she was coughing away. So I was thinking to myself, as practicing anesthesia, when you look at the mouth of the person, normally when you extend the neck, we have to always extend the neck to intubate the patient. When you extend the neck, you find that the epiglottis moves away to some extent, away from the glottic opening. So there is a greater chance of aspiration. So I have seen people drinking from a bottle or even from a glass, because as the level of water gets lower and lower, you continue to extend your neck. And then when the last inch of water is there in the glass, you have a higher chance of aspirating that. So what I has been telling people is, whenever you want to swallow something, get it to your mouth, but always look down when you are swallowing to minimize your chance of aspiration, because most of the old people seem to die of aspiration pneumonia. And this lady also, I don't know what happened. I didn't expect her to die that quickly. And suddenly the daughter sent me a message, say she died. So either she aspirated a bolus of something and she stopped breathing and then she died. So it's a question of always remembering, because there may come a stage where you have to even feed your own spouse, you see, or a third person has to feed you. So always remember, when you are, just the point I want trying to make is, when you are swallowing, always look down so that the epiglottis will cover the glottic opening and you will not aspirate the food or drink that you take in. So that is one of the points that I wanted to mention.
Can I interrupt? Is it looking down or chin down?
Sorry?
Is it looking down or chin down?
Look down, because whenever I anesthetize a patient, I always you have to extend the patient's neck, that is looking up. So when that happens,
head down.
When that happens, you find the epiglottis moves away. It might be to do with the attachment to the epiglottis. So because before intubation, we extend the patient's head. So that is probably what is happening in patients who are ill and being fed. So you got to practice this ourselves to make sure that we are looking down, looking at your plate when you're eating. For one thing, you should not be talking when you have food in your mouth. That is one. Second thing is when you're swallowing something, whatever it is, always look down and swallow. So that is one of the points that I want to bring up.
Talk with your food in your mouth.
What's that? Sorry?
You're talking.
Sorry, huh? So Sam.
Yes.
When you have the uvula.
Uvula doesn't come into the picture.
Yeah, and then you have the epiglottis, the glottic opening that's in the posterior, and
behind your mouth is the glottic opening, but the esophageal or the oropharynx that goes to the esophagus is beyond that. It's more posterior to the glottic opening. So every time you swallow, the epiglottis covers the entrance to the glottic opening. The food passes over it and then goes down to the esophagus. Now that happens. That will always cover if you are looking down when you eat.
So when you say it covers, it sort of bends down.
Yeah, it bends down, and so the food or whatever you eat or drink does not go down the wrong way. So
but when you are feeding, obviously your chin is up because somebody is going to push it down. It's difficult to feed a person.
No, when the person is once you are feeding somebody, once you get the food into the mouth, what I suggest is physically you flex the person's head so that when they swallow, the head is flexed and not extended.
So Sam, in a bedridden person, what do you do? You have in a bedridden person who's lying flat. I mean, he's bedridden. How do you
can still flex the head. You can still flex the head. You can either prop them up or 2 or 3 pillows so that they will be flexed when they swallow.
But there's some, with the diabetic patients, even without it, they choke. You know that long time diabetics.
What's that?
Long time diabetics.
Yeah.
The older person, they choke. No, they have a certain amount of like a dysphagia or thyroid. They choke.
They have gastroparesis and neuropathy. They have autonomic neuropathy.
Yeah, they do. And most of the older people are diabetic.
I want to make a statement. Karunian,
yes.
Sam, I am from the Academy of Family Physicians of America, and the most updated thing about care of the elderly is both the senior people, the geriatric people, as well as the American Academy says very strongly now that tube feeding is not a good way, and we have to feed the elderly orally. So I want to make that statement. According to the Academy of Family Physicians of America, they don't encourage any form of tube feeding for the seniors. Now, Sam brought a very good point about aspiration, and it could be a problem. I think you brought a very good point about care of the elderly.
It's just my observation of anesthetizing patients, and especially this lady died overnight, and they just sent me a message to say our mother passed away, and I didn't want to go into details of what happened because she need not have died. And no, she would have died because she had liver failure, she had ascites, and she would have died within months. But a sudden death, I thought this is probably what happened.
Sam, did they do a postmortem on this lady?
Sorry?
Did they do a postmortem on this lady?
No, they didn't do it because she had been to the hospital a few times to get her.
Liver failure and ascites and all. There is no.
Yeah, the ascites got tapped, and then and I did warn them. They said we don't want to take our mother anymore to hospital. They just do nothing very much and just send us a hefty bill. So I said that's fine. Keep her. But you do get in touch with a doctor and get a doctor to visit because somebody has got to give the death certificate. Because you may have difficulty getting a death certificate. So they managed to get a doctor to visit, and that doctor had come and given a death certificate. So I don't know what was written in there. But but all they said was that mother passed away, and then within hours she was buried. I think they are religious customs. No, within so many hours you have to bury them, and they were so that's all. That's the end of story. But she was going to die anyway, and that got me thinking as to what on earth happened to this lady. That they kept telling me she's coughing the whole time. Obviously, she was aspirating little bits of what was being. Whether she actually aspirated a bowl of food and stopped breathing, I don't know. Because these things happen. These things have happened many times. People chat at dinner and suddenly bolus of food goes into the larynx and you can't breathe. And the only way you can save is, puncture, doing a cricothyroid puncture. So these things have happened many times. So, but I just thought, because at our ages, so to try to tell you to flex your head when you're swallowing.
Take the food in the mouth and then...
If you are drinking a glass of water, you'll be doing that. But when you're down to the last stage, take the water to your mouth, but don't swallow it. Take it to your mouth, look down and swallow it. Don't swallow.
Or use a straw. Or use a straw.
Sorry, didn't follow
Use a straw.
No, use a straw. But those things, a straw may not be available. This is the simplest.
No, but I think, or if you get into the mouth, keep it and then bend down and swallow.
And then bend down and swallow.
Yeah, that's a very simple thing.
If people have this bad habit of trying to talk with food in their mouth, these are the dangerous things.
See, Sam, the time that I'm just thinking of my own habits. When I gargle, when I gargle either with some mouthwash or some salt water, that's the time when I take it into the mouth and...
That's all right, because you are gurgling, you are not allowing it. You have to go to a dentist. Because I tell the assistant, make sure you suck, because your mouth is open and the dentist is working on you and the fluid is coming through. And I tell the girl who is assisting, make sure you suck, because you cannot swallow with your mouth open. It's impossible, because your mouth has to be closed when you swallow. So they make sure they do, because there you can easily aspirate when that happens. So I just thought I'd bring up this point with everybody.
You can't swallow with your mouth open, huh?
You can't swallow with your mouth open.
I never thought of it.
When are you going to hear the words of wisdom?
Because sometimes there are these patients. I used to do sympathetic blocks to the gasoline ganglion for various procedures. Sometimes, because your esophagus, when there's no food, is flat like a pancake. Sometimes when you put the needle in, you could be making a hole in the esophagus, but it's a tiny hole, so it's not an issue. But if you tell the patient not to swallow, if the patient swallows when your needle is there, it can cause a tear in the esophagus. So you tell a patient, don't swallow, they will definitely swallow when you are trying to do the procedure. So the only thing you do is you tell them, keep your mouth open. When I'm doing, I say, keep your mouth open. You are not to close your mouth. So with the mouth open, they cannot swallow. So I'm able to do the procedure. It's a quick procedure, and then it's done.
That's a good one.
Sorry?
Selarat. Yeah. Go ahead, Selarat.
Yeah. Anyway, that's all. That's one point I wanted to make.
Very good. Wonderful. Simple, but a very profound point. Yeah.
These are things that we need to practice at our age. We are now in our, evening of our lives. This second point is, I called a friend of mine, a doctor in the United States in one of the cities some time ago. He said he was in hospital. Oh, yeah, what on earth happened to you? He said, I had an extradural hemorrhage and it had to be tapped. I asked what happened. He said he got up at 3 in the morning and he went to the bathroom or washroom and he passed out. He has hit his head on something and he has had a bleed. Fortunately, daughter took him straight to hospital and he had an extradural bleed. And it was, so he's fine now. He's fine now. Anyway, so what actually happened here? Now, when you are lying down, you are in a horizontal, obviously in a horizontal position. And moment you stand up at our ages, the sympathetic system doesn't work very quickly, and there's pooling of blood to the legs. So your cardiac output drops. So the brain is getting less. Then you go to the bathroom to urinate, to pee, you increase your intra-abdominal pressure and the cardiac output drops further. And your brain gets less blood and you pass out. This has happened already. A classmate of mine died this year. Just after Subba's funeral, I went to his funeral. And so he told me, Sam, in future, whenever you go to the toilet, don't stand, sit down. When you want to pee, always sit down, which I have been doing ever since. So this is another point I wanted to bring up. Because this is what happens, because our systems are now old. They don't function so well because from a horizontal position, when you stand up, your brain gets less blood straight away. And then you go to the toilet and you increase your intra-abdominal pressure to urinate, you drop the cardiac output further. So this is what happened. Fortunately, it is said that he was okay. He had it drained and he's fine, and he's fine. I talk to him quite regularly. So this is the second point I wanted to bring up.
Very good. Sam, tell me something, Sam. Sam, why does the cardiac output drop when you urinate?
When you urinate, you have to increase your intra-abdominal pressure. So the blood flow from the legs is reduced because the pressure in the abdomen is too high. It won't go back. Venous return is reduced through the IVC, you see, to the heart. So the cardiac output drops.
Yeah, because of the posture.
Yeah, posture is the first number one.
The best way is to put your elbow on
gets
your knees and hold your head. That's the best relaxation for your urinary system.
Yeah, but the thing is, if you sit, you are safe. As you get to the bathroom, if you sit, you are safe because you are not standing.
Yeah, no, you're right.
So he says, Sam, in future, whenever you go to the bathroom to pee, whatever time of the day, sit. I've been doing that ever since because he gave me that advice. So I just thought
Advice is found in one tablet called Jude. They are given this advice how to sit is better, and then put your hands on and support your head. That's the best.
Yeah, I mean this. So from there, I want to talk. I did mention it last time also. Why do we people who have prostates have to get up in the night to go to the bathroom at 3 in the morning? So it's because of the enlargement of our prostate gland, mainly the median lobe, which presses out the urethra, and you want to pee and you get up. So I mentioned it at one of the last meetings, start eating pumpkin seeds, which I have been doing for the past 3 years. Since I started eating, and I have told some of my colleagues and friends also to take, and they also swear by it now. They rarely wake up in the night. Pumpkin seeds, and I don't know what the ingredients are, but I think it's got zinc and magnesium. I think there's a combination of which help. I take what shall I say, tablespoonful of pumpkin seeds. I have it with yogurt after lunch every day. In addition, they also mention that cooked tomatoes also are helpful in shrinking the size of your prostate. So, cooked tomatoes. Because the tomatoes release an enzyme called lycopene only when it is cooked. If it is fresh, it does not. So it doesn't get absorbed. You want the lycopene to get absorbed into your system.
So, Sam,
Yeah.
after talking to
The
Sam,
pumpkin seeds. Jude.
Whatever it is, pumpkin seeds.
Yeah.
So Sam,
It's a capsule.
Yes.
after talking to Sam, he gave me a couple of pearls, and I've been following some of them. And one of them was the pumping seed, because it's prostate is a problem for all of us. And I started doing it, and I must say two things. Number one is, I do think there is improved symptoms, and in fact, I think a substantial improvement. And it is nice, I get it. It's salted and unsalted. I got two depending on where I buy it from, and every day I take it, and it really is. It also helps. It's a nice thing to chew and eat. So that's number one. Number two, I went and looked up. I have this app called the Open Evidence, where you can look up everything. And number one, I verify whatever Sam says. Before I practice, I go and verify to Open Evidence.
Don't take my word for it.
My skeptical self, and the Open Evidence says pumpkin seed has it, and it's got an estrogen-like compound which mimics the estrogen-like thing, which is the reason for the improvement in the prostate health. I'm trying to get that. I have had so many questions, I'm unable to find it, but it's got here's what Sam's observation, which I concur with, but there's also science for that. And so anyway, so that's one. And also Sam said something else which I did the same. I'll tell you. What's that? What's that? Someone asked a question?
So, I don't know. Somebody said something just now.
That's an interference.
Okay, right. So those are
if I'm looking at my Open Evidence, if I find it, I'll tell you if
and also read up.
But it's got a hormonal. It's got a hormonal mimicking compound in the pumpkin seed that is responsible.
Could well be. I mean, it's always best to treat what you eat as some type of medicine. So eat things that are beneficial for your health. This is I think the message. That's what the message should be. And also I read somewhere again that this lycopene in the tomatoes also helps to shrink the size of the prostate. Anything red, mainly they recommend tomatoes, but it has got to be cooked. So
I haven't done that yet, Sam. But
do read it up and see what you come up with. This is what I have read in a couple of places. I listened to some guys. This so that's another point I want, because so you won't have to get up in the night to go to the pee and have these issues of fainting. And so anyway,
just want to add one thing. One thing, the pumpkin seed thing, they're also called pepitas. They're usually on many of the breads. They're added in every, like European biscuits, cakes, everything. And I've been a consumer of this for a long time. You can add it to oatmeal, you can add it to cereal, you can add it to salads. It adds a really nice flavor, even if you can't eat it just raw. So you can just add it to your daily consumption of other foods as well, just to add that. Yeah. And I'm a strong supporter of those pumpkin seeds or pepitas or whatever they're called.
You can eat it even on its own.
I eat it raw. I mean, I have a little bottle, and in the morning when I get up,
it's roasted anyway, so you can eat it. There's no issue. I eat it sometimes on its own. Sometimes quite often I add it to the yogurt to get more bacteria into the system.
The raw one really has another special taste. I would just try it sometime.
What is the name, Sarojini?
Well, it's called pepitas or pumpkin seeds, but you can buy it raw, unroasted, unsalted.
I see. But they'll probably might even be better, I think, than the roasted one.
Yeah, put it in
pepitas is raw. It's not roasted, huh?
Well, even the pumpkin seeds you can buy unroasted, unsalted, just raw pumpkin seed. That's what I've been buying most of the time anyway.
Tomatoes. How many tomatoes? I know the tomatoes come in various sizes. how many tomatoes and how many days of the week you have to use?
Well, I can't answer that. I mean, I usually cook tomatoes about 3 times a week, but pumpkin seeds daily. Tomatoes 3 times a week, but on its own, sometimes you can't. Tomatoes cooked on its own, I add a few other vegetables also to the tomato and then eat it as a cut. But pumpkin seeds, I have been eating daily for the past 3 years.
Yeah. So, Sam, you said tomatoes have to be cooked and
cooked or grilled. Otherwise, it does not release the lycopene, which is necessary. Because lycopene will just pass through the gut and that's it. It's not getting absorbed. This is why they say it should be cooked. This then the other point I want to bring up is this intermittent fasting. I took an interest by listening to a American doctor of Indian origin, Salk Institute. Must be where you live, isn't it? Cornell?
Salk is in San Diego, yes.
That guy's lab, he said he did an experiment on mice. He had these 2 groups of mice. One group was allowed to feed only 8 hours of the day, and the second group was allowed to eat at any time. And the number of calories given to each group was the same. So he said they let them feed like this 8 hours a day and no food for 16 hours for one group. And the other group, they can eat anytime, but the amount of food was the same. So they were releasing the food every 2 hours or something for the group that were allowed to eat all the time. And he said 3 months later, the animals were sacrificed and they looked at their organs and they found the ones that were eating all the time had various diseases in their organs, liver, fatty livers and cardiac issues and this and that. And some of them even had malignancies. And he said the ones who were eating only for 8 hours, 8 hours were pretty healthy. So that was the reason why I read about intermittent fasting, and there are people do all sorts of things. What I follow is this, what is most recommended, fasting for fasting for 16 hours. Basically, after dinner, if I finish my dinner at 8 o'clock, my next meal is 12 noon. That is the following day, that's after 16 hours. But in between, you can have anything that has no calories, like black coffee, black tea, whatever you want. And of course, I listened to a guy called Dr. Lee, who recommends drinking green tea. He says it's got a lot of polyphenols in green tea. And to drink green tea every morning or even twice a day, which you can have. And then, of course, have your solid meal. Our solid meal is at lunchtime because we don't work anymore. So you can have a nice meal and relax and carry on and eat only within that 8-hour window. And also, our friend Narada has been fasting for decades. He has not had breakfast for decades. Correct, Narada?
Yeah.
So I just thought I'll bring that up as another point of Karun. You said you read a fair bit.
Yes. So Sam, again, I can do it. I just I couldn't find the prostate where I went back and put it in open evidence. I did again open evidence, and there's double-blind studies that shows that memory and dementia is improved by intermittent fasting.
Yeah.
So after Sam did that, I've tried to do intermittent fasting. I must say I haven't totally succeeded. But on a separate note, intermittent fasting in terms of reduction of food intake has been noted to be very beneficial. And a lot of people practice it without, Sam told me, I asked Sam because I do have immediate memory loss. I still work and I multitask on a number of issues. So I'm a little more worried about, I see patients too. So I'm a little more worried about the fact that my memory is not as sharp as it used to be. I went and looked it up. It's said to improve memory. I'll try and find it or go back and look at it and read it for you guys. But it is scientifically validated from, as you say. Also, metabolically, which is my field, intermittent fasting is very good. And I can tell you one thing, or just a observation. I have a couple of Muslim friends who go very serious, follow Ramadan. I can tell you their blood sugars and their diabetic control substantially improves during the 40 days. And then it decreases because they go back. I tell them, it's good for you spiritually and physically to be on this Ramadan for a longer time. I mean, I've seen it dramatically it improves.
We also fast on Mondays and every Thursday on a regular, and then on the 13th, 14th, and 15th of the Islamic month. So there's additional fasting other than Ramadan.
No, I think if you go back into the religious practices, before the food industry came, almost every religion has some time when they fast.
Yeah, that's true.
I mean, the Hindus have various things in which they'll go fasting for a week at a time at some point in the year. And Buddhist also, I'm sure, have some ritual thing.
Buddhists are not supposed to eat dinner. After lunch, their next meal has to be breakfast.
Yeah, so I mean, if you really look at it, almost every for the Christian tradition, it is Lent. You have to give up something during Lent. People give up alcohol or chocolates or something. That's easy, but so there is some wisdom in that. But I think Sam's point is very good, and I've started doing now. What it also says, which is more valid, interesting to me, is memory loss. It is good for memory.
That's right. Now the thing is, Carmen, the body releases a thing called brain-derived neurotrophic factor, BDNF, which is supposed to stimulate production of more neurons and things like that. When you have time, have a look at it. I have read a little bit about the brain-derived neurotrophic factor. So, which is supposed to improve memory. By fasting.
Brain releases it, huh?
Brain-derived neurotrophic factor.
What releases that?
From fasting. It releases, I don't know from where it releases. I don't know whether it's from the liver or whatever. That is supposed to be very beneficial.
I'll look it up. In fact, I can look it up now on the
BDNF.
BDNF.
Brain-derived neurotrophic factor.
That's the one that can keep your memory in.
Neurotrophic.
Sam, I have a question about meals. I thought the best meal for older people will be having a decent breakfast. Can you make some comments about?
I will tell you what is happening there. These people, there was an advertisement, several advertisements, have a good breakfast to set you up for the day. Set you up for the day doesn't mean a darn thing. But this has been popularized by cereal makers, people who make cereals, Kellogg's and all these people. They are the ones I read somewhere. They are the ones who wanted people to eat their cereals. And they are the ones who started this, have a good breakfast. I mean, now that we not had breakfast for 40 years or even longer, asking whether he has had any problems. As far as fasting is concerned, I found it difficult. 8 o'clock in the morning, I wanted to eat something. Then I managed to get it stretched to 9 o'clock. A couple of weeks later, I made it 10, then 11, and now it's around 12. So you cannot do it suddenly.
The brunch.
You have to do it gradually.
So you have a brunch.
Oh, yeah. Yeah.
No, I know. A lot of eating is habit formation. I think Lawrence can. Okay, can I just read about brain-derived neurotrophic factor? I have in my head. This is a fantastic tool. Sarojini is free for you if you can get your NPI. It's called the open.
I just looked it up also. Thank you.
Yeah. So it says brain-derived neurotrophic factor is a neurotrophin that plays a crucial role in the central nervous system. It is involved in growth, differentiation, and maintenance of neurons. BDNF signals tropomyosin receptor kinase B and the low affinity P75 neutropin receptor, influencing various neuronal functions, including synaptic plasticity and neurogenesis and neuroprotection. Is all the way it acts. BNDF is essential in the development of plasticity when it goes on into autocrine and all the kind of alterations. Alterations BDNF is expression of functions implicated in several neuropsychiatric disorders. But it doesn't say about memory itself. But there's a lot more thing. I'm just saying. So there is something like that. The relationship between fasting and that is not mentioned here, but if you look at it, maybe there will be.
Maybe Lawrence can comment on the memory factors and stuff like that on this.
Hold on. I got a question here. How do exercise and diet influence brain-derived neurotropic factors? That's what Sam is asking. He's generating an answer. Hold on. Exercise and diet significantly influences brain-derived neurotropic levels, which are crucial for neuronal growth and differentiation. Physical activity is factor. Diet. Nutritional factors also modulate BNDF. Diet rich in omega-3 fatty acids, antioxidants have been associated with increased BNDF. Okay. Additionally, Sam's point, caloric restriction and intermittent fasting have been shown to enhance BDNF levels, potentially through similar metabolic pathways, which activate exercise.
Yeah.
So
there's one other point I want to make, which I read again, listen to a guy, some expert on food and nutrition. He says that after about 12 hours or so, the blood glucose level drops and the fat is broken down, and the ketones that are produced are supposed to be very beneficial for the brain. Ketones. And he also said, this guy also says that you are giving a rest to the mitochondria in your cells, because the mitochondria do all the work with the glucose. When it comes to fat metabolism in the liver, the ketones that are released provides the energy to the brain and all other parts of the body. So that gives a rest to the mitochondria that can repair itself. This is what this guy says. So because
that's a story. I don't think mitochondria can ever rest.
I don't know. This is what this guy says. All I'm saying is, I don't know Carvian. I'm not obviously not expert. I'm only saying what I. He says the tired mitochondria can regenerate. I don't know how it works or whatever. Whether it's, and also if it breaks down fat, then you have a chance of reducing your weight and getting your weight down to, a BMI below 25 in those who are above. So that advantage is also there.
But what Sam says is validated here. Diet, low calorie diet, and really helps. But this is the first time I'm talking about. You didn't tell me about BDNF when you talked to me, but I went and looked at intermittent fasting, and intermittent fasting is good for memory loss and so on and so forth.
Yeah, I mean,
I also learned something else reading through that, Sam.
Yeah,
the memory is in the what is that?
Amygdala.
Amygdala. Amygdala apparently can regenerate cells, which is the only part of the brain that can regenerate. I haven't verified that, but I heard that. So that memory loss is not irreversible or inevitable. I think it's a matter of activity and memory and eating right and exercising, and I suppose exercising memory.
Sam, I have one more question. They say that eating vegetables and fruits is good for your health. Can you tell about older people and vegetables and fruits?
Well, I mean, what I have read and what I practice is basically I follow what is called the Mediterranean diet. You are supposed to eat the vegetables that you eat and the fruits that you have must have all the colors of the rainbow. Colorful vegetables and colorful fruits are supposed to be very beneficial. So, which I have been eating on a regular basis. So, vegetables definitely are, and fruits, all types of fruits. They say colorful fruits And each one has a different type of polyphenol I have read, which are all antioxidants, which will benefit you. And also, then you will also have your regular bowel movements on a daily basis, and which reduces chance of getting colonic malignancies and things like that. And one thing I eat regularly, of course, I must mention is okra. Every day, okra, boil it and eat it, in addition to all the vegetables, which gets the bowels moving on a regular way, on a regular basis.
Thank you.
Lawrence, can you tell us whether there is any solution to memory loss?
Complicated. Memory is two kinds. There is what is called semantic memory, which is the meaning of things and words and habits, and there's episodic memory, which is the sort of narrative of past events. And then there's something called working memory, that short-term, like if I tell you a telephone number, you can hold it in your head for a couple of seconds, but you lose it after about 10 seconds. So working memory is the problem that all people have is what is called recall, immediate recall, being able to get at something straight away. So it's not about your loss of memory, which happens in dementia, but that you have the memory, but you can't recall it at will as you can do at young. So it's not a memory loss, it's an impairment of the power to recall. Like somebody asks you the dose of a drug and you used to know it, you can't get it. And then you think of it when you're thinking of something else. So the information is there, the memory is there, it's not lost. So the impairment of recall is the problem, and that's not really affected by these elements. And very little is known about why, as we get older, our recall gets impaired. So it's too simplistic to try to be DNF and just one or two chemicals. It's a large interplay, and certainly glutamate, GABA, and all those substances are also quite actively involved. So it's not a problem of memory, it's a problem of functional memory.
Can I bring up another, something I wanted to bring up is this immunotherapy for cancer. I read that Jimmy Carter had immunotherapy for his cancer and recovered completely. And there's an immuno-oncologist in Paris who found that some of her patients did not benefit from immunotherapy. And he or she, I don't know, examined the stools of all the patients and found that one of them, the ones who did not respond, were lacking in an important bacterium called Akromansia, Acromansia. I don't know if you want to take it down, Carmen. Akromansia. Acromansia. And this immuno-oncologist gave these patients a glass of pomegranate and cranberry juice every day for 3 weeks and examined the stools of these patients, and there was this bacterium present. It's supposed to be extremely necessary for immunotherapy that stimulates the immune system. This particular bacterium called Akromansia. So I just thought I'd bring that up as because you may come across somebody who is having immunotherapy, get their stools examined and make sure they have got enough Akromansia bacterium in their stools.
And so could you just
you ask, you can ask.
What else, Sam?
Akromansia. It's a bacterium that we have a gut microbiome One of them, acromantia, usually 5% of the bacterium in your gut is acromantia. The people who did not respond to immunotherapy did not have this particular bacterium in the gut. These are Paris immuno-oncologists who found out. He gave pomegranate juice and cranberry juice for 3 weeks and found that the acromantia was built up. I don't know.
So why don't we just everybody take that?
Yeah.
So, Sam, what are the things for pomegranate and cranberry?
Cranberry and pomegranate. I mean,
cranberry juice and cranberry juice. So whether we
pomegranate juice and cranberry juice.
So you want to know what
Sam,
you want to know what acromantia musciphilia.
Yeah,
you want to read it. It's a gram-negative mucin-degrading bacterium that resides in the gastrointestinal tracts of humans and other animals. It is a prominent member of the gut microbiota, particularly enriched in the mucus layer of the intestinal lining. Mucophilia plays a significant role in maintaining gut barrier integrity, modulating immune responses, and contributing to metabolic health. So that's the immunity, the gut barrier immunity. Three things. It plays an important role in maintaining gut barrier integrity, modulating immune responses, and contributing to metabolic health. The bacterium degrades mucin to produce short-chain fatty acids such as propionate and acetate, which are beneficial for the host. Mucophilia has been associated with various health benefits, including improved glucose metabolism, reduced body fat, decreased inflammation. It is considered a potential next-generation probiotic due to its enhanced ability to gut health and its therapeutic potential in metabolic disorders, obesity, and inflammatory bowel disease. So, Sam, you are giving us words of wisdom. I never heard of.
Well, I mean, these are things. I mean, we got time. I tend to read as much as possible. Listen to all the experts in the field. Like there's a guy called Sinclair. If you want to live long, he says, I have a cold water shower every morning. So that kind of thing. But just pick up a few points here and there, and try and advise other people. I mean, that's why we are here.
Lifestyle.
Hi, Sam.
Yes.
Sam, this is Padmalingam.
Yeah, I know.
Did I hear you say you like the cold shower? I always like a warm shower.
No, this is what this guy Sinclair says. You have to give a shock to the body. David Sinclair, Howard, he says you have to give a shock to the body so that it stimulates itself by taking and also when you take a hot shower, you are getting rid of the skin microbiome, which is essential for your skin health. Talking about skin microbiome, the normal pH in our skin is about 5 to 5.5. All the soaps that people use are alkaline, and that kills off your skin microbiome. And they advise you not to use soap. In fact, what I do is, what do you have to get rid of from your skin? Dead epithelial cells, those are things that I just rub them off. The only places I apply soap to are my ears, axilla, and groins. That's all. And I have a normal shower and I give a rub with this rubber thing I have to get rid of all the dead epithelial cells. That's all you need. I don't know why people, they advertise soap for the babies. Why do they need soap? But, just a normal water is more than enough. And this gut microbiome depends on our secretions to survive. They are the ones who protect us from pathogens, skin pathogens.
Very good. I think we've been told a lot of our habits are based on commercial soap industry and food industry. Food industry is there's a lot of damage. But on the other hand, food industry has helped by preserving food has helped to decrease supply of food. Improve supply of food. Otherwise, there were people who were starving because they didn't have refrigeration and so on. So it has got its pluses and minuses.
Yeah, I know. For instance, if they say don't eat junk. If McDonald's and please like millions of people will be without jobs. But this is what they say, don't
Not jobs, but there was one study I saw very early, about 20, 25 years ago. It came in BMJ. that the McDonald's started in the 50s. After McDonald's started, there is a correlation between McDonald's fast food and obesity in the US. Tracking it, there's a direct correlative parallel lines rising obesity with the fast food industry. However, the one justification they gave, the malnutrition, undernutrition and malnutrition in the elderly population in London decreased after fast food became available because they had easy availability of food, people to eat, because that's a huge factor. A lot of people have difficulty cooking and eating every day, and so it's
I mean, you go to a restaurant because 99% of the people eat junk. All these carbohydrates, lots of carbohydrates. I mean, sometimes I don't eat rice at all. Instead of rice, I eat chickpeas, and then all the vegetables around it and fish. And then after lunch, we'll have the various fruits, including pomegranate and mangoes and whatever is available, and pineapple, which helps with the digestion anyway. The bromelain in the pineapple. That's the kind of stuff that we are supposed to eat. I mean, when you're young, you may as well, have your fun. But as you get older, one has got to stay as healthy as possible, so that you don't have to be dependent on other people to look after you, over the few years what we got left.
I think there is a thing available called the friendly bacteria.
They are supplement. The friendly bacteria are the ones that are in the gut as well as on your skin. They are the ones who produce all sorts of chemicals and send messages
made into capsules, and they are selling it as well.
Yeah, I mean, they sell things like when you take antibiotics, they sell probiotics because you kill some of the bacteria. They sell probiotics as well. They recommend that you
probiotics, Sam.
Yeah,
there are a lot of people who question it's again a commercial gimmick, because the number of bacteria you eat in a probiotic thing that you eat, it is psychologically very nice and good feel.
I see.
But it's so small, it doesn't make a difference.
I see.
What about yogurt?
Yogurt has got yogurt is
fair
good.
Amount of probiotics.
Yeah, I have it daily with my pumpkin seeds after lunch. Yogurt.
So yeah, okay. Anyway, yogurt is good, no question.
Yeah.
Real words of wisdom. You have made about 6 or 7 or 8 points. I didn't write it down.
There's another point I want to make about coenzyme 10. And coenzyme 10, those who are on statins, they say everybody who is on statins must take coenzyme 10 because the coenzyme 10 is depleted because it's supposed to be the same pathway where the statins also act in the liver. And coenzyme 10 also, there are 2 types. Ubiquinone and ubiquinol. Ubiquinol is the one that it lasts long, absorption is better and it lasts longer in the body. This is what I take. Ubiquinol.
Ubiquinol,
Ubiquinol, because sometimes you go to a health food shop and they say coenzyme 10, but you don't know whether it's the ubiquinol or the quinol.
Quinol, P-H-E-N-O-L.
N-O-N-E, other one give you a N-O-L. Quinol is supposed to be the one that one
P-H-E-N-E, P-H-E-N-O-N-E.
ubiquinol. This one.
P-H-E-N-O-N-E. Quinol.
No.
Quinone and quinol. Quinol is the one that we should be taking. And sometimes they don't say which it is. You can read up about ubiquinol.
Yeah, so Sam, I just put it in my
right.
quick. So I'll tell you, it's a little surprising to me because I have read about this earlier, and I went to some literature and looked, and they found a double-blind trial that it really doesn't help.
That
was the earlier one, but I just read it because in terms of the cholesterol metabolism, they say CQ10, because everyone talks about this. Years, people, 5-10 years, they said people on statins should take it, and so I did not take it. I thought it is one of those waste of money that we all do. But today, after you told it, I just went and looked, because you are eating 100%. Everything you say has scientific validity, even though you are not maybe looking at it. But I'll tell you what this says. The coenzyme Q10 helps in increasing brain-derived neurotropic factor, the BDNF that you talked about, levels, and offers a potential benefit for brain health and neuroprotection. Okay, now, statins have been associated with some dementia in other people. Some people, you know that, right? Statins have associated with memory loss. Several studies have demonstrated that CQ10 supplementation can elevate BDNF levels. For instance, a study on ischemic stroke patients showed a 30-day regimen of CQNH 600 milligrams per day significantly elevated BDNF levels alongside reducing oxidative stress.
That's 600 milligrams.
Okay. And inflammation, suggesting a neuroprotective benefit. Another study on rats, also, I don't want to go through everything. Additionally, pre-treatment in Alzheimer's disease rat models also restored hippocampal BDNF level. That is where the memory is multiplied. Anyway, long and short of it is, it helps. And I have to change my mind because I had to go and buy it today.
Yeah, I used to tell you and you used to poo-poo and say don't. Remember, I wanted to buy it long ago when I started taking statins. And you said, no point. Don't.
We can't see you in them.
Never mind, but I mean, you can hear me, right?
Especially when you criticize your husband. We can hear you. Especially when you criticize your husband, you should have to show your face.
Sam, what dose do you take? Because you can get it for
600 milligrams.
300 milligrams.
600.
Quinone.
600.
I take 600 milligrams.
Okay, thank you.
This one other thing I think is also important is about fluoride in the toothpaste. I read it in a newspaper, because now fluoride is what has saved teeth of millions of people, because fluoride is, benefits your gums and yours. But what we often do is we use fluoride toothpaste, but we wash it off. You brush your teeth and you rinse your mouth and the fluoride is lost. The British Dental Association recommends that after you have brushed your teeth and flossed your teeth, you apply a thin film of toothpaste to your gums before you go to sleep, so that the fluoride stays in your gums and strengthens your gums and your teeth. Because fluoride is supposed to be the thing that has minimized dental caries in people. So I just thought I'll mention that also to you.
So Sam, I have looked at this earlier when I was practicing pediatrics. We routinely give fluoride drops to children, and there's absolutely no doubt the dental caries in children. Yeah.
Sorry?
There's absolutely no. Someone say about this.
Sorry, can't hear you.
Someone else is talking. So, Sam, can you hear me now?
It's Senarat's iPhone. I don't know if you can silence it.
Hello.
Yes, Senarat.
Yeah.
Yeah, I mean, just a minute. I can't come on the video when I'm on the phone. So the moment I try to get on the video, I'm getting cut off.
Yeah.
Okay, that's all right. Okay, no problem. Thank you for joining, Sam.
Oh, I have been listening right through.
Okay, all right, great.
When can we have these recorded? I mean, you are recording it.
It's on the YouTube. I'll send you the address, how to get it.
Okay, that's fine.
And also the recorded one also is there with me. And you also have a AI companion recording it.
Yeah.
So it is typed, and then I'll send it by email as well.
Okay, Maru.
Great. They're really good. It's good stuff. Sam, coming to fluoride, there's absolutely no doubt that dental caries, which is the commonest illness in children, was substantially decreased by adding fluoride to the water distillate, not fluoride toothpaste. We didn't have fluoride toothpaste. Fluoride toothpaste is a different game, which was introduced by toothpaste manufacturers to increase, sale of toothpaste. and it is mainly in children, and fluoride in toothpaste also strengthens the teeth. So there's no question. But now we have a mad health and human service guy who's got all kinds of crazy ideas. Maybe he has got one or two nuggets, including immunizations don't help and so on. He wants to take fluoride from water all over the country. You know,
Really, that's a shame.
he must be angry on dentist friends. They'll get more business. We got some crazy fact of people here. But among the things he wants to stop is fluorination of water. But there's well studied, that fluorination helps.
Yeah, the question is, Karunya, even if you drink fluoride, because it just goes through, but if you apply this toothpaste, very thin
correct, no
to
question.
your gums before you go to sleep, after you brushed your teeth and done the flossing, everything.
No, but do we need more than what is in the water is the question.
But then when you water is not going to stay in your mouth. You're going to drink
but I don't think it's local. The impact of fluoride may not be absorbed directly. It may be through absorption in the stomach, and I don't know. I'm just thinking.
No, I don't know, but this is what I read somewhere. The British Dental Association had recommended it because it may be getting absorbed through the vascularity of the the gums. So I mean I have been doing it for a while after reading it. In fact, and also our teeth. I went to see a dentist here recently because he said I thought I had a dental caries, and that guy looked at my teeth and said it's really age-related wasting of the teeth. He said my enamel was gone in that corner and it was attacking the dentine as well. So he filled it up. But so I think because some of these things, if they are harmless, it's always better to do it. You may as well apply a thin film of toothpaste after you have brushed your teeth. But what you normally do is, we brush our teeth, we rinse our mouth, fluoride is lost.
I think I think the kids nowadays have been told that from a very young age. For my example, my grandkids, when they were little and they brush their teeth and they don't rinse out their mouth, I say, why aren't you rinsing out the toothpaste?
Yeah.
They say,
if you don't rinse your mouth,
they say we don't do that anymore. We've been told not to do that.
So tell me again, Saro. I'm sorry.
I see the wisdom of what Sam is saying. So I guess that's what they've been told from a very young age.
Oh, so tell that again, Saro. I missed it.
I said my grandkids, when they were very little and I was with them, I don't know, from age 4, 5, whatever, when they were brushing their teeth, and I would expect them to rinse out their mouth with the toothpaste, and they wouldn't do it. And I would say, aren't you rinsing out your mouth with water? And they say, no, we have been told not to rinse out our mouths after brushing our teeth. So I let it go, but I never understood why. But now I understand with what Sam is saying, and makes a lot of sense. So just something going on with the pediatricians, at least this is in Washington and Philadelphia, East Coast area. When my kids were little, which is now they are grown. So this is, I don't know, almost 15, 20 years ago.
Karunya, Padmalingam again. What I want to say about fluoride is in infancy, when they start developing teeth as early as 7, 8 months, you have to varnish with fluoride once a week while they are growing up. That's part of your pediatrics. Am I right or wrong?
Correct. And also remember, there is the secondary dentition that's there, and that is not seen, that's not external, but is there and growing and developing. And fluoride, ingest fluoride in the water helps those teeth, not only the teeth that are visible, but the teeth that are hidden and are going to erupt later. So remember, the infants have two sets of teeth. They come initially and then again. And so maybe for that, the dental paste won't help the teeth that are not erupted yet.
Caries developed because of lack of fluoride.
Fluoride, and also I just thought I'd bring something similar in a way. I don't know whether some of you may be taking vitamin D3 and K2. I usually take 4,000 units and K2. You see because the D3 is supposed to help to absorb calcium into your body, into your bloodstream. And you don't want more, you want most of that calcium not to linger in the bloodstream. You want it to get to your bones and your teeth. And this combination of vitamin D3 and K2, the K2 is supposed to increase the absorption of calcium into the bones. And K2 also, there are two, Mark 7 and Mark 4. What is recommended is Mark 7, this one. Mark 7. So this is something I have been taking since COVID, because one of the medical registrars who was looking after COVID patients used to see me regularly, and he said a lot of these patients had low levels of D3, and when they were given D3, they improved. And now it has become a common thing for people to either, even if you have to either expose yourself to the sun to get your D3, and but D3 alone, I read, is not sufficient. You need to take it with K2, Mark 7, to take the calcium to the bones and to your teeth. So that's...
No, the vitamin D and the COVID is well documented. But I didn't know about the K2.
K2 is because obviously as you get old, your osteoclastic activity is higher than osteoblastic activity, and you can easily fall and fracture neck or femur. That's a commonest fracture that you come across. We used to sit all night and anesthetizing for neck or femur fractures. So this is supposed to strengthen your bones.
So how do you normally get vitamin K2?
I don't know whether you can get it in your diet. Maybe you can. I don't know what, but I take it as a supplement anyway. K2, the Mark 7 carnium, because it's supposed to be better absorbed and last longer in the body. There are two Mark 4 and Mark 7, MK4 and MK7.
Vitamin K2 is essential for carboxylation of osteocalcin, a protein that binds calcium to the bone matrix.
Yeah.
By improving bone mineral density and reducing risk of fracture. Never heard of K2, yeah.
Okay. So those are the points that I wanted to bring up and have a chat about.
Last time we had a nutritionist who said about the K2.
Yeah. Sorry?
I said Milroy was promoting this K2. I remember one time, long time ago.
Who?
But I don't recall all the details.
Who did?
Milroy Fernando.
Sam, you made about 8 or 10 points, simple points. Can you just put 1, 2, 3, 4, 5, 6 and put it in the chat group?
Yeah, Maruti got it on the system now. No,
but recording and listening is an hours-long procedure.
Yeah, I think ideally you
you had very specific points.
I'll see what I can do for you. Yeah, okay.
Yeah, just 1, 2, 3, make a list.
There's one little point I wanted to bring up again of practical importance: air conditioning. Now, when you fly in an aircraft, the air, now in an operating theater, the air is exchanged every few minutes. It's always fresh air coming in. When you're on an aircraft, all the air is, there's only a certain amount of fresh air comes into the aircraft. The rest of the air is recycled, because otherwise it's too expensive for the airline. And it's supposed to go through what are called HEPA filters, and they may not be that effective, because there are so many people with during COVID got picked up the COVID virus while flying. So I was going to suggest that whenever you fly, you don't know how many people are carrying viruses, to always wear a good quality mask on your flight, except of course when you're eating. So this is something I wanted to just mention.
Good advice. Sam, all these points you have made, I wish I had taken down notes. Just summarize it in 2 lines.
Yeah.
Because, I told a couple of other friends of mine too, having been impressed with your little wisdoms of pearl that you gave me. The Cyril learners want to join, but then it's 6 o'clock, he didn't join. If you give a list, we can circulate it around to friends and family and others.
Yeah.
Without all the extra.
WhatsApp group, and let me see what the AI has done, and also I will check it. But
Yeah, you check it. If you can do that, Maruf, see.
I will do that, and you can also send put the list on.
Yeah, then I can come back to you. Yeah.
Maruf.
Hi, Salima, I can see you in the background.
Maruf.
Yeah. Senarat has a question.
Maruf, to leave at the moment.
Sorry, what's the Senarat?
Trying to find out.
So we meet again in a month's time.
This is one of the things I wanted to start with, but I had actually put in my the headset, so you were not listening. I think the discussion was very interesting, and going forward, I think we have had a meeting for a few months now. So shall we have it another in May or June?
Maybe in 2 months' time.
Once in 2 months, I think.
Yeah, once in 2 months.
Lawrence, can you give us a talk on memory?
Okay.
Good.
Okay.
So 2
Before
months
we
from
leave,
now,
I have one more question for Sam, maybe.
Yeah, sure.
Sam, do you think there's any big difference between the vegetarian, what is it, the oil that we take instead of the fish oil?
Olive oil.
Omega 3.
I mean, if you
That
take
and because I don't take the fish oil, I take the
Omega
flaxseed.
3.
Flaxseed.
Yeah, you could do that or eat fatty fish.
I don't eat
Omega-3 or take tablets of omega-3.
There are tablets available, and also the fatty fish, mackerels and sardines and.
No. Apart from
Fish
eating
has
the
a
fatty
lot of
fish,
lead in
what
it
about the
because of
vegetarian, the one that comes from the flaxseed?
Yeah.
Lawrence had a point.
I don't.
We had a talk on this, and he made the point, which I follow, that is that you should get it from algae or vegetable sources, because the fatty fish has a lot of mercury in it because of contamination. So I don't go for the fish oil from fish sources. I go for vegetable sources.
Yeah.
That sounds interesting, because obviously.
No. Actually, out here, Academy of Pediatrics told parents not to give fish to the children because of mercury contamination.
Yeah.
This mercury lingers in the body for years, but the body does get rid of it very, very slowly. That's what I read, but it takes time. Yeah, but I think I agree with Lawrence, because too much fish also, you could be increasing the quantity level of mercury. And also I wanted to mention a little bit about microplastics, because now they have found microplastics in the brain as well. And I read somewhere that they have found people with dementia, I don't know whether Lawrence has read, that had when their brains were examined, they had a higher number, a lot more microplastics than in other brains. So one of the things I have stopped using is tea bags, because they say the tea bags are made of paper, but they spray it with plastic to keep their shape. So when you put that into boiling water, most of the plastic gets into the boiling water, and we drink it on a regular basis. So I have stopped taking using tea bags. I buy the tea leaves, but sometimes it's very difficult in Western countries to get the tea leaves. One alternative may be to cut the tea bag and put what is in the bag into your tea, and then strain your tea.
Yeah.
I just thought I'll mention that.
And
But so
also,
it's only on
I was told by a friend.
item.
Sorry.
Sorry,
I
it's
was
only
told,
on one item, tea bags only?
Sorry?
Is it only on tea bags or anything else?
No, anything else also. I mean, they all, I mean, water bottles contain micro. I mean, if you're buying if you have an alternative, for instance, I'm very fond of this Kitul treacle in Sri Lanka. I add a little bit of it, and you get it in plastic bottles as well as glass bottles. So why go for the plastic when there are glass bottles available? No, if there's an alternative, use the alternative. Cut down on the plastics as much as possible.
And also coffee, the Keurig that we use here, I don't know, in the US is very popular. I had and I drink from that. So easy to make. It's a plastic cup, and I was told that also has the same microplastic problem. So I think by and large, avoid plastic containers in whatever you do. Normally,
So food canisters.
Also the microwave.
We put food in food canisters and put in the fridge, you know.
Also the microwave.
Yeah, one of the things that we do, we take the
Microwave.
plastic bottle water and leave it in the car. And when it gets heated up, this plastic will dissolve in the water. And I never, I have seen papers writing about the plastic is one of the major health problem. And if you have plastic bottles, we leave it in the car and take it back and drink. And because we are heating,
what is the alternative?
Dissolving
what is the alternative? Glass, is it?
Alternative is glass or metal?
Glass bottles are better
but
than
then they are heavy, no? You can't be carrying glass around.
I know, but you have to weigh it against your health. You see, it may be heavy, but you know,
if it is heavy, your muscles get better.
Yeah.
No, it's not that. Say,
there
you
are nice
go to the office
metal
somewhere else, the children, suddenly something drops. Glass shatters, isn't it? So you have
but there are lots of
get a
nice
safety
metal
of that.
bottles and other things. Sam, okay, Padma, I have a question for Sam.
Yeah, I have one also for Sam. This
Which is
about caffeine. Between coffee, decaffeinated coffee, as well as the famous Sri Lankan tea, which one is better, tea or coffee?
What I
Green
have read
tea.
is they are both supposed to be good. I have read that coffee is supposed to take something called chlorogenic acid, which is an antioxidant, polyphenol. Then tea, I was told that green tea is better, has more polyphenols than black tea. So it's but I take green tea usually twice a day, and I have black tea as well, and coffee. And of course, coffee, you have to think in terms of, the caffeine and, whether you will get your good night's sleep with a high dose of caffeine in your system. I mean, those are things you have to weigh.
What I have read, Padmalingam, is that caffeine decreases the quality of your sleep. So if you want to preserve your sleep, you should not take caffeine for at least 8 hours prior to sleeping. So light cup of coffee.
My wife takes the green leaf tea and I take the regular tea.
The black.
Sam, one other question. Any thoughts on refined sugar?
Sorry?
Any thought on refined sugar?
No, I don't take any sugar. I do add some, Kitul treacle, which I add sometimes to my tea. I like the taste of it. And I don't know, the research was done in Sri Lanka. They gave sugar to a group of people and Kitul treacle to the other group, and their blood sugar level, the Kitul treacle people, their blood sugar level didn't go up. That's what it said. I read some little article in one of the Sri Lankan SLMA journals. So I take a little bit of that. And it's got to be pure, that some of these treacles, Kitul treacle or even the jaggery, has got sugar. If it has sugar, it will be quite hard. The pure Kitul jaggery is soft. In fact, you have to keep it in a fridge. So that is what I normally have with my green tea sometimes, not always, because I try not to take any calories during that 16 hours of fasting.
Wonderful.
That was a very nice presentation. We enjoyed
Thank
it
you,
very
guys.
much.
I'm so happy that I was able to chat to you all, because I have been reading and talking to people, advising people whenever I can.
Yeah, Lawrence, you have a question?
Yeah, the two quick points. The thing to avoid is what is called single-use plastic, the stuff you buy your water bottles and discard. Those leak some of the highest rates of microplastic. So be careful when you buy bottled water. The other quick point about Padmanabhan's question on breakfast is, I don't know whether you know that Kellogg was invented by Dr. Robert Kellogg to stop people masturbating in institutions. He thought a bland diet would stop them masturbating. So that's why he invented Kellogg's cornflakes.
Once again? Tell me again.
What is that?
I couldn't quite follow.
Kellogg's cornflakes was invented by Dr. Robert Kellogg. He thought a bland diet would stop people in institutions masturbating. So that's how you got Kellogg's cornflakes.
I see.
So think about it when you have your cornflakes.
They are the guys who said eat your breakfast for the what is the term that they use? Set you up for the day, which doesn't mean a darn thing.
I know. I fully agree.
Hi, Slimo. Right
anyway,
here.
Guys, I got to go.
Okay, guys, one minute. Sam, once again, a commitment from you and Maruf to put this down in a point form.
Yeah.
Because I like to give it to others.
Right.
You know, you have knowledge and good knowledge, you should spread it. So we should spread it as a group. And friends, please give it to others, because these are really good words of wisdom. Some of these I have verified it scientifically valid. It's not only folklore or Sam's opinion, but they are good, valid points. And Sam, I really appreciate your common sense wisdom. That's really impressive.
Thank you.
One more statement. We lost one of the most important person a week ago, and the funeral was this morning. What I am saying is, let's talk a little about our Pope, if you don't mind, Karanian. You start to talk about the Pope.
Well, I think he was an extraordinary individual.
Yeah.
Wonderful guy who actually, in my opinion, I am a Christian by faith, practice the essence of Christianity, which is to care for the poor and the underdog and the oppressed. And he brought it to an institution that was not, Catholics were always more concerned about the poor than many of the modern day Christian nationalists in the US, who are a horrible group of guys. But anyway, so he really was an extraordinary guy. Came from, he had concern for refugees.
Brazil.
Was very, very, very.
Venezuela, yeah.
In fact,
Argentina.
In fact, I wanted to say, even in Sri Lanka, even the temples, Buddhist temples, they were reciting gathas for the Pope. For the first time, I have come across that.
Even here, everyone does. And also, he's concerned for the gay community, and he was not dogmatic. He was very human. There's a story told about him, about a little boy, who, a 9-year-old boy. He went to a simple parish priest. It's in the YouTube. And there was a little 9-year-old boy who wanted to ask him a question. He was talking to the people, the children in particular. He always loved them. And so he was asked him to question. And a little boy came up to the mic and started weeping, and he couldn't ask his question. So he asked the boy to come to him and whisper the question into his ear. So he got him and, held him around, and in his ear, the boy asked the question. And so then the Pope asked the boy, can I share it with the rest of the congregation? So the boy said, yes. So the question the boy asked, the little boy would, my father was a good man. He died, but he was an atheist. But he baptized his 4 children, and he was a good man, but he died. Will he go to heaven? That is the imagery and the structure of the. So the Pope told the congregation, worried about his father who was an atheist going to heaven. My first question is, it is so nice. My first comment is, so nice for a 9-year-old boy to come up and say, my father was a good man and a nice man. And then I want to ask you a question, all to the congregation. Would God ever reject a good man? So his question was, it doesn't matter if you're Baptist or atheist or not. If you're a good man, would God reject him? And the congregation said, no. So it's very humanistic.
Yeah, if you are good, that is God is in you.
Yeah. Anyway, so that's what. He was a good man.
One last point before we go is that this is the first meeting after we lost N. Sachi recently.
And Subba. And Subba also.
Subba also, yes.
Subba and I told Karuni, no, Moonamali also died, both. Jupiter and
Moonamali also died, yeah.
Moonamali. Oh, really? I didn't realize that.
Both husband and wife are dead.
Really?
Where did Moonamala, where did he live?
Kurunagala, I think, somewhere off there.
Right. Yeah.
I'm sorry. I mean, Sachi was he was ailing in the last year. I saw him last year when I visited England.
What was his? What actually happened? I mean,
he had renal failure long ago. He had a transplant done. But he walked on, and he was doing very well. He was the usual feisty Sachi. When I saw him last time, I had dinner with him. He was very, very. I think Saro also had dinner with him, right?
Yeah, we had dinner with him, and they were such a hospitable, beautiful family.
Mm-hmm.
Just really incredible, the hospitality they showed, the friendship. We hadn't seen them in such a long time. But Jnanam and the children, and he opened some bottle of wine that was, I don't know how many years old or something like that. And of course, Nihal and Mohanlal were highly impressed. I didn't know what it was all about, but they were just such a wonderful family, such wonderful. I have really, really good, lasting memories of that one.
So I kept in touch with him, but latterly could not talk to him over the phone because of his hearing. He had lost his hearing. And so at home, of course, he had to talk very loud. He would converse. His wife was a pathologist, she's an oncologist, very hospitable. She was my wife's classmate, very hospitable, good people. And his children, daughter is an ophthalmologist. The son is economist. They are good, very nice family. And I think Mohanlal kept in touch with him, right? I don't know whether Narada did.
Mohan was at that dinner too that day. Yeah.
Great.
Of course, Subba, he was ailing for a long time. I talked to him once or twice over the phone, over the thing, and he was very upbeat and very positive. The 2 times I talked to him. But he was...
I attended the funeral, and for the first time I saw his daughter, who is very much like Srima, Kuba's wife, because we were all together in Kurunagala. We were house officers there. We knew each other quite well. And I was quite surprised. She was an image of the mother. And I met the son also. And that's the day I met with this Ranjita Bevikrama was struggling to walk. And I was asking him, what's going on? He said, he had been diagnosed with this normal pressure hydrocephalus. He doesn't want to do anything. And finally, he got worse. And the wife was able to take a decision and take him to hospital, contact a neurosurgeon and got a shunt put in. And he's now recovered well. And he had gone home yesterday. I went to see him the day before. Anyway, these are things that we have
this happening in our life.
Yeah.
Today.
Anyway,
but we are fortunate to have this and keep going. We have to keep going. My little solution to age-related things. Sam gave some very practical, useful points. My little thing is you need to have people, purpose, and health. So those are three things.
Nelson Mandela once said, you can have thousands of worries, But if you have one health worry, you'll forget the thousands.
That's true.
Karunian.
Yeah.
Karunian.
Yeah.
Can you spell your son's Kabilan's first name?
Ahilan, Ahilan.
Ahilan.
My son has been in the news a little bit. He's an immigrants' rights lawyer, and he was one of the lead lawyer. He now is UCLA, the professor there.
Press the button.
But he was a lead lawyer in the case again deporting the Venezuelans. So he stopped the deportation of. He won the case, initial case, and the deportation of almost 650,000 Venezuelans were stopped. I mean, it's a special category of immigrants called TPS. So he was a lead lawyer in that. So Padmalingam, that's why he's asked him to look up. His name is Ahilan, the last name is same as mine, Arulanandam.
Wonderful.
Yeah.
Right.
He was also there. He was just last week. He also won the appeals court. Now he's going to the Supreme Court. Government will appeal.
Fantastic, fantastic, Karunian.
Thanks.
Before we leave, I want to say hi, Slimo. I haven't seen you in a while.
Thanks,
Very
Sam.
good.
That's
All right.
excellent.
Okay,
Bye.
bye.
Thank you.
Take care.
Thank you,
Come
Sam.
sometime.
Thanks again.
Thanks,
Sam.
Yes,
Meet again one of these days.
Okay.
Benita.
Yes.
I am very sorry about us on the phone. I know how much of a good Catholic Christian you are, Benita.
Actually, she's not
Yeah, I know. I suppose that's
Accept
let's see.
sympathy.
That is life, no impermanent.
Yeah, I know.
Yeah.
I did right too. Nice to see you all. Glory.
See you.
Bye. Okay.
Thank you very much for coming.
Thank you,
Thank you.
We must spread the word.
Maruf and Karunian.
Thank you, Shrima. Good seeing you, Shrima.
Yeah, good to see you.
Are you keeping healthy?
Yes.
Very much, yes.
Hi, Srima. Yes.
Shrima, thank you for joining us.
Bye and thanks.
Thank
Are you keeping healthy, Shrima?
Okay, Narada.
See you.
Bye-bye.
Bye-bye.
Bye.
Hi, everyone.
Bye. Okay.
See you in 2 months' time.
Okay,
Yeah.
take care.
June.
Bye.
Okay. See you. Thanks, Karunian. Thanks.
Thanks, Maruf. Thanks.
Yeah.
Okay. All the best.
Okay,
Thanks,
Karunian,
Glory.
thanks for
That
organizing
was
all
a good
this.
one.
No. Thanks. Yeah,
Maru and Karunian.
No. Thank you, Sam. I talked to Sam, and I really, when you tell me, Sam, I don't just take it. I go and look it up.
Yeah, I'm glad you do that. I know you do. You have
Because there's
to.
so many things floating around.
Yeah, I
mean,
understand. Because sometimes
academic
what is on
investigators.
YouTube is absolute rubbish sometimes.
Yeah.
They put a lot of nonsense in YouTube. You have to check everything. Double check.
Yeah, but yours have checked out every time. Yeah. Thank you.
Okay then, great. All right. All the best. Bye.
Thanks, Sam. Thank you. That
Bye.
was great.
Thank you.
Yeah.
Thanks, Sam.
Thank you. Hi, Glory, Edwin. Thank you. See you.
A Zoom meeting?
Yeah.
That's fine. Whatever happens, we can adapt.
Thanks, Maruf.
Oh, thanks a lot.
I am going to give. Yeah. But more.
I think Paddy came first and he's still late there.
Tamima has to go away. She can't stay there because Rob won't tolerate it. Siri, he'll be fine, but Rob won't tolerate her being there all the time. So best thing is, if Daddy's not here, you move there. Shamima and Siri lives here. And then Shamima can stay for the full 3 weeks and support Siri. You see what I mean? Yeah. Mommy, please don't worry about these things. There's never really, you worry, and there's never really a problem, is there? So I wouldn't worry too much. Daddy, you finish your Slimo?
Yeah.
Come then.
Yeah. Anybody interested in intermittent fasting, they should read the article in New England Journal of Medicine a few years ago It can cure dementia and reverse Alzheimer's disease too.
Article on dementia and?
No, article on intermittent fasting.
Intermittent fasting and dementia.
In New England Journal, New England Journal of Medicine, with a lot of references.
NEGM, huh? NEGM.
Yes.
Yeah, if you can put it on WhatsApp, the reference, I will spread it. I think everybody will get it.
Okay.
Thank you very much.
That was a very nice meeting. We should have another in June at least.
Yeah, definitely.
Make sure we have, and Ratna Sabhavdi said he can give the presentation.
Excellent. I think it's a lot of effort to bring the people together. It's not easy.
Yeah, but I think we could have had more, I think.
Summertime is coming. People are going to be traveling. We're going to Sri Lanka.
You should have one in June, Maru, please.
Yeah, sure, definitely.
Next month, our second grandchild is graduating out of high school to go to college. So 30th, we'll be in the state of Indiana to attend the graduation ceremony.
Okay. We got to go now. We're going to leave.
Okay, Pat. I think you are the one who came first, and you are the company last as well.
Okay.
Everybody has gone.
We are always with you because you have organized this group in such a way. For example, we are all together. For example, I wanted to mention the name of the Pope so that Karunin can say something about it. And Benita is a very good Catholic Christian growing up in Jaffna. I knew Benita at high school. And we attended medical school together.
Okay. Bye.
Okay, then.
Bye.
Bye.
See you soon. Yeah. Keep in touch.
Thank you. We saw Salima. I said hello to Salima too.
Yeah, she's here. My daughter has come and she's talking to her.
Good.
I invited my daughter also to join, but they couldn't.
I'm happy Raj joined it. She enjoyed it and she learned a lot about health from Sam. Sam is a good guy.
I think he's a collector of
remember
information.
Sam Soiza, Nalin Perra, you and me, we go dancing together. You remember that?
Yeah. Brody group. Okay. Bye-bye.